the disease is actually reversible. But you have to know how to reverse it. If you don't know how to reverse it, then you're just going to get worse. And the thing is that the drugs don't actually do anything for the disease. And this is also not controversial, because the thing is that type 2 diabetes is a disease of too much insulin resistance. And that's not controversial. Everybody acknowledges that, right? So if you have very high insulin resistance, it's going to cause high blood sugar, right? But that's the symptom of the disease. The disease is actually too much insulin resistance. So the treatments that we give are all targeted at blood sugar, right? That doesn't make any sense, because it's almost like, to give an analogy, if you have an infection, if you have a leg infection, well, you need to treat that infection. So what was causing it was bacteria. You give antibiotics. But that infection can give you a fever. But that fever is not the disease. If you start treating that fever as if it is the disease, then that leg wound is going to fester, because you're treating the symptoms of the disease and ignoring the disease. But that's what we've done with type 2 diabetes. We're treating the blood sugar, but it's not a disease of the blood sugar. It's a disease of too much insulin resistance. So what happens is that because we're not treating the disease tends to progress. So if you look at what happens over a period of 10 years, 15 years, what happens is that you start off with one medication, then you take 2 medications, then 3, then you take insulin, then more insulin, and more insulin. And after 10 years, you started with one medication, now you're on 100 units of insulin a day. Well, you're taking more medication to do the same job, to keep that blood sugar the same. That means your diabetes is worse. Even if your blood sugar is better, your diabetes is worse than it's ever been, because you've never actually done anything about treating the insulin resistance.